Hello everyone, I'm Sania Sheikh and my topic is anti-malarial drugs. So the subtopics we'll discuss are the classification of anti-malarial drugs, its uses, and three drugs: chloroquine, amidaquine, and mefloquine. Now let's see what is anti-malarial drugs. So these are drugs used for prophylaxis, treatment, and prevention of relapse of malaria. So malaria is an acute infectious disease caused by four species of protozoal genus Plasmodium. Plasmodium species which infect humans are Vivax, Ovale, Falciparum, malariae. Now let's see the uses of anti-malarial drugs. Its uses include prophylactic use, curative use, and radical cure and gametocidal use. To prevent clinical attack of malaria is prophylactic use. To treat clinical attack of malaria is curative use. To completely eradicate the parasite from patient's body is radical cure. And to cut down human to mosquito transmission is gametocidal use. Now let's see chemical classification of anti-malarial drugs. So the first class is 4-aminoquinoline, which includes chloroquine, amidaquine, and pipraquine. Quinoline methanol, which includes mefloquine. Cinchona alkaloid, quinine, quinidine. Piconide, proguanil. Diaminopyrimidine, pyrimethamine. 8-aminoquinoline, primaquine, and tefnoquine. Sulfonamide or sulfone, which includes sulfadoxine, sulfamethopyrazine, and dapsone. Antibiotics include doxycycline, clindamycin, sesquiterpene lactone, artesunate, artemether, arteether, and arteroline. Amino alcohol, halofantrine and lumefantrine. Naphthoquinone, atovaquone, and naphthyridine, pyronaridine. So this was the chemical classification of antimalarial drugs. Now let's see the first drug, that is chloroquine. Pharmacokinetic of chloroquine includes it is rapidly and completely absorbed from GIT. Substantial portion is deposited in RBC, spleen, liver, kidney and lungs. Slowly released from these sites helps in maintaining therapeutic plasma level when used for prophylaxis. It is given just once a week. Also crosses blood-brain barrier and excreted predominantly in urine. Now let's talk about the uses and adverse effect. So the uses are, it is used in arthritis, amoebiasis, lupus, lepra reaction, mononucleosis, photogenic reaction, malaria and giardiasis. Adverse effects are retinal toxicity, microdeposit, nail and mucous membrane pigmentation and ECG abnormality. Mechanism of action of chloroquine. So the parasite digests the host cell's hemoglobin to obtain essential amino acid. This process releases large amount of hemoglobin, large amount of heme, which is toxic to the parasite. To protect itself, the parasite ordinarily polymerizes the heme to non-toxic hemazoin, which is stored in the parasite's food vacuole. Chloroquine prevents polymerization to hemazoin. The accumulation of heme results in lysis of both parasite and RBC. So this was the mechanism of action of chloroquine. Now let's see what is chloroquine resistance. So chloroquine resistance is fast in developing Plasmodium falciparum and is major problem because several cases of malaria are caused by these species. It is slow in Vivax and multi-drug resistance, sulfa, pyrimethamine, proguanil and quinine. Resistance develops due to efflux mechanism. Now the next drug is amidaquine. Its properties are quite identical to chloroquine and even chloroquine resistant strains may be effective. It is less bitter, so it is preferred. Next drug is mefloquine. It is developed to deal with chloroquine resistance B falciparum, rapidly acting erythrocytic schizontiocyte of chloroquine sensitive and resistant plasmodium. Also effective for multi-drug resistance B falciparum. Its mechanism of action is also similar to chloroquine. Kinetics involved are well absorbed orally, highly bound to plasma protein, concentrated in liver, lung and intestine, enterohepatic circulation 2 to 3 weeks. Now let's see the adverse effect, its contraindication and uses. Adverse effects are bitter taste, nausea, vomiting, diarrhea, QT prolongation, neuropsychiatric reaction. It is contraindicated in psychiatric disorders, cardiac conduction defects, first trimester of pregnancy. The uses are multi-drug resistance malaria in combination with artemisinin, uncomplicated falciparum, chloroquine resistance, and chloroquine pyrimethamine resistance. Now we have gathered enough information to solve some MCQs. So let's see if we can solve it.